Hey everyone, if you're just joining us now, we're going to get started in about 10 seconds. I encourage you to say hello to the panelists or to pose your questions. You can enter it into the chat box below.
Okay, my name is Tony Leah. On behalf of Green Jobs Oshawa, I want to welcome everybody for joining us. There's some extremely important issues facing us right now with the COVID-19 crisis. And one of the most important of those is the impact that it's been having on our frontline workers, including our frontline health workers, who've had a disproportionate number of infections. We've had people dying, and that's absolutely unacceptable. And it's unacceptable that our governments have not faced up to how serious the problem is. But what we want to talk about is those problems and solutions to those problems. We cannot allow the Ontario government, the federal government of Canada, to portray themselves as dealing with this problem, that it's under control, because it's not under control. And the way that we can understand the problem is that we have to listen to the frontline workers that are facing this crisis. So today we're going to hear from those frontline workers, and we're going to hear the proposal that Green Jobs Oshawa is putting forward to solve a very important part of the crisis that we're facing. I encourage people when they join us to say hi in the chat box. You'll also notice that on your Zoom controls that there's a Q&A button that allows you to pose questions to the panelists. When our three speakers have finished their opening remarks, we're going to give first crack at questions to any media people who have joined us. But then after that, everybody else will have a chance to participate as well. So thank you all again for joining us. I said that it was important to hear from the voices of the frontline workers, and our first speaker is Pam Parks, a registered practical nurse, so one of those frontline workers. Many of you will have seen the really powerful statement that was published in the Toronto Star a few days ago by Pam and two other nurses, Judy Bain and Maggie Jewell. So Pam, please go ahead. We're all eager to hear what you are facing and what is going on.
Yes, hi everyone. Can you hear me okay? Can you hear me okay? Hi
Yes.
everyone. Once again, my name is Pam Parks. I'm a registered practical nurse, and I work at the Lakeridge Corporation. I'm actually an Emerge RPN at the Oshawa site. Ontario is failing to protect healthcare workers. There are painted rocks, flowers, bouquets, and handmade signs outside our hospitals and long-term care homes. These are welcome offerings. The thanks to healthcare workers inside touch us deeply. It's all help. For the legion of us on the ground working throughout COVID-19, pandemic in the hospital, long-term care homes, paramedic service homes, and other community care settings. The reality is that things are grim. It has never been grimmer. In nearly 100 years of nursing between Maggie and Judy and myself, we've dealt with many medical emergencies. We nursed through SARS, nursed old and the very young, and some who died in our arms, but nothing compared to what we're dealing with since COVID-19. Ontario healthcare workers are dying, and we have a rate of infection that nears the most severe in the world. We need our provincial government to significantly change its approach to do this virus and the support given us fighting to keep others alive during this crisis. Reflections and improvements are an essential part of our nursing practice. All of us must reflect on whether we can approach COVID-19 differently and affect the outcome for the people we care for and that of those we work alongside. When Ontario downgrades safety protocols in the face of supply shortage to treat this virus as though it can't be transmitted by hair of aerosolizing procedure, we began to worry about our safety and the safety of patients and residents. With the safety protocol downgraded came the green light for a much lower level of face protection. Now the vulnerability to infection is palpable the moment we step into our workplace because we don't have access to the masks and other protections we should. We are afraid of dying. We worried about taking COVID-19 home and infecting our family. Thousands of us sleep in basements, sheds, trailers, so we won't pass the virus to our kids and partners. COVID-19 is lurking. It could come the next time we care for patients or residents. Screen or admit anyone, disinfect an emergency room, empty a garbage bag, fix a burst pipe. It could come from a coworker who, because we're not all tested, is unaware they are COVID-19 positive. Access to the higher level N95 mask and other personal protective equipment, which we all know now as PPEs, would keep infection rates lower. Perhaps those whose advice the Premier are telling him all is in hand, that healthcare workers are getting PPEs. This is not true. Many nurses, personal support workers, cleaners, dietary staff, admitting clerks, maintenance people, and many more are being denied N95 even when dealing with COVID-19 positive or assumed COVID-19 patients or residents. Many more for being given just one surgical mask and gown and told to make those sodden, soiled, and supplied last the day. Colleagues across the province report there is not enough PPE supplied to don and doff masks, gowns, gloves as we go from one patient and resident room to another. This is at odds with good infection control practice and leaves healthcare settings rife for virus and transmission. They even went as far as telling us that other infections such as VREs do not isolate. Make sure you wash your hands properly, as if that alone will protect us all. More than 3,700 Ontario healthcare workers are infected with COVID-19. That's 17% of all cases in the province. Countries that are isolated with COVID-19 positive patient in hospital tested widely and protected healthcare workers using airborne protection fare much better than Ontario. With 81% of COVID-19 deaths seen in long-term care, it suggests to us that Ontario approach is failing. New York State ordered care homes to transfer residents with COVID-19 who they can't look after to hospitals. Why aren't we doing that? Finally, we are thankful for the pandemic pay subsidy. We appreciate the gesture and the recognition we get from the Premier, but our nursing is supported by an army of ward clerks, clerical staff, dietary aides, maintenance, sterilization, technologists, spiritual and lab pharmacy staff, amongst others. We're all on the front lines battling COVID-19. All our work is physical, emotional, exhausting, dangerous, deeply undervalued. Yet half of us don't get the pandemic pay. What is suggested to our workers is that their work is not, as a front line, is not valuable. All of us are our team. Do not divide us. Treat us all equal. Protect and pay us all. And please, please protect us with our safety equipment. Thank you.
Pam, thank you very much. That's again, a really powerful statement. And we all have to do everything we can to make sure that what Pam is saying, that the voices of those frontline workers are heard, listened to, and acted on by our governments, because so far they have not. Our next speaker is Rebecca Keetch. She's been an organizer with Green Jobs Oshawa since we began, and she's a laid-off General Motors worker from Oshawa. And of course, that is part of the situation that we're dealing with here, that thousands of workers were lost their jobs when General Motors ended vehicle production in Oshawa. So Rebecca, please go ahead.
Hello. So on April 24, the Canadian government announced that they had reached an agreement with GM Canada to convert a portion of the GM Oshawa complex for the manufacture of much needed medical masks. Green Jobs Oshawa welcomed this important step forward. However, it soon became apparent that GM's plans for Oshawa are far short of what is needed. They are only making level 1 surgical masks, not the desperately needed N95 masks. General Motors Canada has the ability to manufacture millions of N95 masks in Oshawa. GM is already manufacturing N95 masks in the Warren, Michigan plant, and Warren is the template that is used for setting up mask production in Oshawa. The GM Oshawa complex has 10 million square feet, most of which is not being utilized. The existing mask production is reported to use only 30,000 square feet. There is ample room to expand production. GM Canada is employing 50 to 60 workers for mask production. When GM eliminated vehicle production in Oshawa in December of 2019, they eliminated the jobs of 5,000 highly skilled assembly and supplier workers. Thousands of those workers are available and would be eager to manufacture N95 masks and other urgently needed PPE for frontline Canadian workers. General Motors of Canada asked for and received $11 billion of public money in 2009. Now, GM of Canada is in the position of being able to make a significant contribution to the public good in Ontario and Canada by greatly expanding manufacturing of PPE in Oshawa, including N95 masks. If GM Canada will not voluntarily support our communities, we call on our governments to use their emergency powers and order it to be done. Canada has an alarming shortage of over 100 million N95 masks, as well as shortages of other key PPE and medical equipment. Instead of ensuring that all frontline workers wear N95 masks, the best protection against airborne infections, health institutions have instituted rationing, locking up the limited supply of N95 masks, and encouraging health workers to rely on surgical masks. The result to frontline workers are devastating. As of May 19, there were 4,043 cases of COVID-19 among healthcare workers in Ontario. 17% of all cases in the province. That is more than 4 times the infection rate in China. Frontline workers across other industries are also impacted by PPE shortages. To ensure an adequate supply of N95 masks, government should order that they be manufactured here. They have not yet secured sufficient production either through imports or domestic production. There has been a collapse of nearly all global supply chains, and it's been described as being the Wild West. This is why the obvious solution is to greatly expand PPE production at GM's Oshawa complex. The Ontario government can order this under its existing emergency powers. The Canadian government also has the ability to order production under its own emergency legislation. In the US, the president used his emergency powers to order GM to make ventilators, and GM seemed to get the message in moving on to masks. In Canada, the emergency powers have not been used in spite of the extreme shortage of N95 masks and other equipment, nor are there any indications that either the provincial or federal governments have pressured GM to make N95 masks. Although it's worth noting that the province did use its emergency powers to remove rights that workers had negotiated in their collective agreements. Here are some very disturbing facts. More than 1 in 6 of those infected by the COVID-19 virus in Ontario are frontline health workers. Among the total population under 60, more than 1/4 of those infected by COVID-19 are frontline workers. On a per capita basis, Canada has among the worst records in the world in the number of frontline health workers infected by COVID-19. A survey of CUPE health staff found that 87% of healthcare staff do not have access to the PPE they need to deal with COVID patients. The Ontario Nurses Association made and powerfully documented similar concerns. Complaints of inadequate equipment have come from other frontline workers outside the health sector, including Amazon. When the federal government signed a contract for Amazon to be distributor of health equipment, there was no quid pro quo for protection for workers. According to the Ministry of Health, within the long-term care sector, an astounding 39% of the infections as of May 18, 2020 are of staff, even though they are a fraction of the population in these homes. According to the same Ministry of Health data, as of May 14, 2020, in a number of long-term care facilities, the number of staff infections are almost the same as or higher than those of patients. As of May 14, 2020, the federal government had ordered 105 million N95 masks to distribute across the country. According to Public Services and Procurement Canada, some 11 million have been received, only 11%. And of these, a staggering number have not met the tests for usefulness. On April 6th, GM began production of masks, including N95 masks at Warren, Michigan, and ventilators on April 15th at Kokomo, Indiana. GM Canada is not making any ventilators and only starting mass production of masks, a distressing 6 weeks later. But amazingly, it is not making the critical N95 masks at all. This bears repeating. We don't need hospital workers, long-term care workers, transit drivers, grocery and food supply workers, and every other person this country has now recognized as essential to be heroes, risking their life every day at work to help others. We need them to be able to confidently and safely go to work, knowing they have the proper personal protective equipment to keep them safe and their families safe. Green Jobs Oshawa is calling on the Prime Minister and Premier to immediately order the production of essential medical equipment and supplies at the GM Oshawa complex. The ideas Green Jobs Oshawa is putting forward make sense, and the demand is clear. We must start the manufacturing of N95 masks immediately. We should make use of Oshawa to be able to securely source vitally necessary medical and other products for the future. The lack of preparation for this pandemic is a stark warning. We must do better. Thank you.
Thank you, Rebecca. Some really important points there. And we need to continue to get the message out and not allow our governments to pretend that they have things under control. It's absolutely shocking that over 100 million N95 respirator masks are in order, and maybe 1 or 2 million have been received that are usable. That is incredible, and we need to keep hammering that point home. When the Premier says in the legislature that the supplies are there and that Woodbridge is manufacturing N95 masks in Ontario, that's not true. I don't know if he knows that he's making untrue statements or not, but we have to continue to go back to the voices of the frontline workers if we want to understand what's actually going on, what the problems are, and what the solutions are. And so we're going to turn to our next speaker, Michael Hurley, who's president of the Ontario Council of Hospital Unions, CUPE. And Michael, please go ahead.
Thank you very much, and thank you to Green Jobs Oshawa for your great initiative here. Let me ask the question right off the bat, like, why wouldn't General Motors be interested in making the N95 mask? And I worry that maybe one of the reasons is because there's a much bigger market for the other masks. There's a fairly specific market for the N95 mask, which is healthcare workers and frontline workers, but there's a much larger market for the other procedural masks, the surgical masks, which of course would be of interest to the general population when they go shopping, etc. So General Motors may have to be persuaded against its its natural instincts to do the right thing here by federal or provincial government intervention, ordering them to do what the market, doesn't actually direct them to do. Why should we care about this? Why is the mask so important? Well, as Rebecca mentioned and Pam mentioned, as of this morning, 4,178 Ontario healthcare workers have contracted COVID at work. Just pausing on that number for a second, bear in mind that's a number you should treat with great skepticism because the numbers are actually being repressed. Many healthcare workers who get COVID, even under circumstances in which it's apparent it had to happen at work, are being told that didn't actually happen, including people who've died. And of those, we now have, unfortunately, 12 Ontario healthcare workers who've contracted COVID and died. And as the previous speakers have mentioned, if we compare our performance to other jurisdictions, you can see, how poorly Ontario is performing. China, for example, as a percentage of total infections, healthcare workers are 3.8% of all infections. In Ontario, it's 17.3%. 23 people have died in China, and a province that has 1% of its population has already lost 12. So put in context, 60 times more healthcare workers in Ontario with that particular stat. And, the public should be concerned about this because each of these healthcare workers who's inadequately protected, the thing about the N95 mask, of course, is that it screens 95% of the particulates that are airborne. There's a lot of debate about this issue of, is this virus airborne? You can find the latest science on this, which is emerging on the website of the Ontario Council of Hospital Unions of CUPE on the coronavirus webpage. And you'll find lots of recent studies from diverse groups like the University of Nebraska, the National Research Council in the United States, the Journal of the American Medical Association, and many other sources that say that actually this virus is airborne. It's been tracked in studies in Wuhan, China, as suspended in the air for 3 hours, moving meters and meters away from the patients in a hospital room, down the hall into the air shafts. And of course, if workers are wearing protective equipment which doesn't actually protect them, then they ingest the virus, they become sick, and of course, as you all know, many people can acquire the coronavirus and not manifest symptoms. So these people go on to infect other patients, residents in long-term care, and other staff. And this explains, we believe, one of the reasons why Ontario has such a horrific record with respect to long-term care in particular, because its stubborn policy of refusing to admit long-term care residents to hospitals and forcing their treatment in relatively close proximity to residents who don't have the virus, tended to by staff who are given surgical masks. They have to wear their entire shift without changing them, and gowns, who become unwittingly agents of spreading the virus by virtue of the lack of equipment that they have. This sets up this dynamic for horrific and unconscionable outbreaks of the virus in long-term care. The insistence that we not move anybody to hospital, that we not segregate them, that we not provide them with care, coupled with the fact that people are in close proximity, tended to by people who are inadequately protected and become sick themselves, but not all of whom manifest symptoms and therefore go on to pass the virus to others. These are the conditions under which coronavirus is spreading. In Ontario, like almost 60% of all the cases are happening in long-term care. Nationally, it's 81%. Give you that as an example. So, what are we to do here? We have the federal government just announced that it was writing down its order of N95 masks by 50 million. They've received 50 million masks that they've had to write off because the construction was shoddy. Both the provincial and federal governments announced these whimsical, magical numbers of masks, which are always coming but never actually arrive. And here we are with unused manufacturing capacity in a major urban center that's ideally located to transportation, by rail, by air, by road. And the same company is actually manufacturing the very mask that's vitally required at its sister plant in Warren, Michigan, something the Ontario government denied, by the way. They denied that the masks were being made in Michigan, and we had to provide them with the General Motors announcements from Warren, Michigan, that in fact, no, it's making the surgical masks and the N95 masks in that plant. So it has the schematics. The masks are already NIOSH approved, which is a problem with the Woodbridge plant. That N96 mask has not actually been NIOSH approved yet. So it has the schematics. It's an international corporation spanning both of these countries. It has the capacity. It has a huge laid off workforce, which is eager for additional employment. So all of these things can come together. What's missing here is the political will. And I would just say on behalf of the healthcare workers that we represent, that the staggeringly high casualty rate is just so unacceptable and so scandalous that so many people are sent into conditions which they imperil themselves, imperil their families, imperil all of the people that they take care of and their coworkers, because no one has had the political will to insist that a major corporation do in Canada what it's doing in the United States, only 100 or so kilometers from the Windsor border. So we're here today to call on the federal government, which has been largely idle during this crisis, and the provincial government to summon the will to order General Motors to manufacture the N95 mask and to begin the production of that immediately in Oshawa. Anything else is just hope that rests without a foundation in reality. We need to shift to domestic production, and we need to do it now for the sake not only of the healthcare workers, but as importantly, for all of the people that they're caring for.
Michael, thank you very much. That is the outrage that all of us should be feeling and expressing right now. And we need to join our voices with the frontline workers like Pam Parks, their representatives like Michael Hurley, and do whatever it takes to get our governments to act, to show the political will that is needed to protect frontline workers and to protect all the people that they're dealing with. I believe that we're joined on this webinar by the MPP for Oshawa, who's been a stalwart supporter of workers in the Oshawa area and has been an ally in these battles. It's Jennifer French. And if we can get Jennifer French on, she wanted to address everybody.
Jennifer, if you're able to click the raise your hand function, I can give you the ability to turn on your audio and video. If you see it down in the participant area, here we go.
There is Jennifer.
Welcome, Jennifer. You should be able to turn on your video and microphone.
Okay. Are we in business?
We are.
Great.
Please go ahead.
So I'd like to welcome everyone to my basement. This is where I spend much of my time, and I'm very glad to have a window into the world to see folks who are doing such important work. all familiar faces so far, because of course we're all in this together and have been working on this front certainly for a while. I thank Green Jobs Oshawa for the work that they're doing, and Pam, I would love a copy of what you read if that's okay, and with your permission to holler some of your words across the Queen's Park floor at the government colleagues, just as a thought. But I wanted to reassure folks, and Michael, thank you for your voice and your advocacy, of course, and all the work that you do. There is some political will, but it's pushing those who with the political won't. I had alongside the community and Green Jobs Oshawa been glad to write a letter directly to the Premier that we sent back in April 15th, and here we are on the 21st, and we still don't have the masks churning out yet. So this has certainly been a situation where folks have been dragging their feet, although you know, like Tony said, we were glad to see that General Motors made the decision, well, got forced and came on side and have committed to doing things here in Oshawa. But we need, as we've been hearing, we need the N95s. But I would say not only the N95s, to Rebecca's point, we're in this for the long haul. We know that, and we need to have the capacity to make whatever it is that's going to be needed next as well. So as we're seeing in as we said in Warren, Michigan, that that could be used as a template. We're not reinventing the wheel. We have the approvals. There is no reason to not demand this and to not have this. You know, this is not a pipe dream. This has been done elsewhere. It can be done here, and no one would argue the need. I don't mean to go long. I know I was just to sort of say a few things, but I am putting finishing touches on the letter that will go directly to the Premier and other folks in the broader Durham region, because I want my government colleagues to know what is going on and hopefully to get on side and push from the inside, although we'll see, to call for General Motors to make those N95 masks. So I know I've got a call scheduled this week with Michael, and I'd like to get a little bit more information. I appreciated hearing about that marketplace pressure and kind of that as a motivator or as a deterrent to making the masks, and that isn't what should define it. What should define the motivation should be the need, and we have the need, and we will continue to have that need. You know, being at Queen's Park on Tuesday, across from Minister Elliott, the Minister of Health, who maintains that all workers have the PPE that they need, that the government has worked out the deals with them, you know, employers and organizations to provide the masks and the PPE. That is not what I've been hearing. That is not what anyone is hearing from their loved ones, from workers, from the folks actually doing the heavy lifting and working on the front lines. So we need to ensure that people have what they need, that we make it locally, and that we protect the folks who are working so hard. And I know that we are appreciating them right now, and calling them heroes. And I really took Rebecca's point, and it's something I've heard, of course, from people before, that they are not choosing to be heroes. They are doing their jobs, and anyone who goes to work and does their job needs to have the tools that they need, the resources and the protection. So I'm, of course, on side working on this letter with folks, and my goal was to have it out by today. Didn't happen, but I will put some finishing touches on it tomorrow after talking to Michael and get that in the Premier's hands and push in that regard. So I'm on side, and I would love to have these the manufacturing capacity, of course, be prioritized here in Oshawa for not just the folks in Oshawa, but for everybody across Canada. So those are my 2 cents, or maybe it was a little more than 2 cents, but I'm a politician, a former teacher, and you give me a microphone. So
Jennifer, thank you very much. We appreciate that, and it's an important part. What you're doing and your colleagues are doing is an important part of keeping the heat on our political leaders, because they have not demonstrated the political will to do what is required. They are, making excuses or trying to minimize the problems. And when we understand the scale, as Michael and Pam pointed out, the devastation that's being caused, the number of workers infected, the number of workers who have died, the patients who have died, we can't. It is outrageous, and we need all to be demanding action.
And Tony, I'm sorry to, you haven't muted me yet, so I'm going to take that as a go ahead.
Go ahead, please.
On Tuesday of this week, when the legislature resumed, the official opposition had introduced a motion calling for an independent public inquiry into long-term care, and it was gut-wrenching. To hear the stories and the letters of families and families of workers and families of those who have gotten sick or have died in long-term care. And for the government to not only vote against the motion, but to, counter offer with a government-controlled commission where they can handpick the people involved, the scope of the, of whatever the investigation looks like, of all parts, and whether or not any of it is shared, really speaks to the motivation of this government. And we have to push, we have to be loud, and we can't be fooled by the platitudes or by the, oh, good, we're doing a commission. No, that's a problem. We need that public inquiry, the accountability. What my office is hearing from families is soul destroying. And there has to be learning. There has to be, it's not just about figuring out the blame. It is, we are in this for a while. We have to keep people safe going forward. There's a lot to learn. There's a lot that has to be, there has to be, I guess, a reckoning as well, but there must be answers. And again, like we're hearing from the minister, like we heard from the premier, there's sort of this platitudes or a story being told that is, we're all in this together. We're all, doing what we can, and all is right with the world. And that is not the case. So everyone does have to push. Send your letters to me, send them to my colleagues in across Durham region, copy my office so I can push them too. But we are all in this together, but we've all got to actually push. So I'll do my part.
Thank you very much. I don't know if there are any media folks that have questions. If there are, please indicate in the Q&A or the chat. I will review a couple of questions that have been submitted and then allow the panelists to respond to them. One person asked about the start of production of the existing production of masks in Oshawa, how many workers, how they're being recalled, what rate of pay will apply. I think Rebecca answered some of that, but maybe could provide some more details. What outreach has been done to get more people on board in this campaign. Who can make the decision to make N95 masks? There's also been some comments about the length of time it's taking for action to happen, for supplies to be provided, and maybe we can focus a little bit more on why there are such delays. And finally, there's a question about other manufacturers in Canada, and some names are mentioned that there are other companies that might be able to, or say they could, or are trying to address some of the supply needs. But I think that there are issues with raw materials. How do we deal with all of that? And is it sufficient to just rely on our existing model of letting companies step up when they think it meets their needs or when it's profitable for them, or is there a better way of doing it? So do any of the panelists want to address those points?
I can address a couple of them. So as far as the questions about the production of level 1 masks, I believe started May 11 at GM Oshawa on one shift, and they have a second shift that should be starting next week. and that will bring the total number of employees up to 50 or 60. My understanding is that it's being done under GM's collective agreement. So the rate of pay that those employees had when they were laid off is the rate of pay that they'll have when they get recalled. Outreach that has been done to get others on board. Green Jobs Oshawa has been doing our best to shout off the rooftops. This is the second press conference webinar that we've hosted. We have been in touch with unions. You can see we have Michael Hurley here, Jennifer French is here, Pam Parks. They're representing different health organizations and level of government. We have been writing letters and speaking at different events. Green Jobs Oshawa has been asked to speak at a number of webinars. This is a problem that has a solution. This isn't a problem that we're facing that we can just say, oh my God, what are we supposed to do? There's nothing we can do about it. We know what we can do about it. We have a problem with healthcare workers and frontline workers becoming unnecessarily infected because they don't have proper PPE. We have the ability to produce the PPE in Canada, in Oshawa. And, Michael brought it up. Again, they have a location. There's no reason why anything that's produced there couldn't be distributed across the country. They have the location. If they need goods, Canada can provide raw materials and resources to that location easily. It's accessible. They have a laid off workforce. They just shut down auto production a few months ago. They have a large facility that's usable. What needs to happen is government will and government direction. And with those things, if you have government using their Emergency Measures Act or any other emergency powers that they have, they can redirect resources to these things that are critical and needed right now. There's a GM has, there was just an article out that in Warren, they've just increased their mask production up to 3 million because they were able to get a sanitizer equipment that they needed from hockey teams, from the Detroit Red Wings and another hockey team. Those are the types of solutions that you come up with when you need to. So you need to think outside the box about what are the bottlenecks in the supply chain and how can we overcome those. And it's something that is directly dependent on government will and getting corporations and businesses on board, whether they like it or not.
Thank you,
And
Rebecca.
I can,
Pam?
yeah, I can speak on a couple of the outreach that we have been doing, leading by OCHU Michael. We have been, I don't know if you can see my shirt, but I have an N95 mask on my shirt. We've done that in the hospital because, as we all know, with social distancing, we can't go out and do protests. So we ask our members to wear these shirts. You're getting the employer's attention when they are at you telling you to get your members not to wear those shirts because it's against the dress code. We're very creative. We still are able to wear it. We got our members to outreach to the Premier's office, send emails in regards to how important it is to have our N95 protection PPEs. And we do like different, like a silent protest, but it's not. And you have to really be creative on how you do that because you don't want to break the protocol of our 6 feet, 2 meters. And we're trying everything we can to get the message out there that this is very important, that our healthcare workers being in hospital, home care, long-term care, the paramedics out there, home care, that we as a membership, we go to work to protect not only the patients, but all of us. And we need a proper protection to actually do so that we're all safe. So every day it's actually we're living it, and all we ask, we reach out to the community to respect what the government is telling you in regards to social distancing. It's very important that you do that because we need to keep all of us safe, not just in the hospital or home care, but as you're out socializing, make sure that you keep that in mind. And I'll turn it over. Mike, I'll have more, I'm sure.
No, I'm great.
Michael?
That was great. Oh, that was great.
Anybody else on any of those topics? There's another question about asking, is there a gag order on staff working in hospitals? That is part of the reason we're not hearing enough about these issues.
I can answer.
Sorry, go ahead, Ben.
I can answer that for full disclosure. As of 2 weeks ago, I was the CUPE president at Lake Ridge for CUPE 6364. And it's not that there's a gag order, but the employer would like to think there's a gag order. But as leaders, we actually, you have to educate your members that when it comes to your health and safety, there's no gag order in health and safety. And you got to protect yourself. You got to speak up. And if at the end of the day you ask for your protection, you call your health and safety rep. If they refuse to help you out, and we will take it from there and call the Ministry of Health. So to us, workers, there's no gag order, but if you ask the employer, there's a gag order, and we don't agree with that.
Michael, did you want to add to that?
In healthcare, it's a very coercive environment. It's a very undemocratic environment. And people have been told that if they speak up about the issues related to safety or whatever, that they can be fired. And people have been fired, of course, in healthcare for speaking up about violence. And so this is a very real problem that we have, is that you know, the workforce on the one hand labors under having limited rights in some areas, like no right to strike, a very limited right to refuse unsafe work. And I'm sure that you've seen that of the public sector work refusals, none of 240 were upheld by the Ministry of Labor, right? So limited right to refuse in healthcare, there's only about 40 in healthcare. And there's a repressive environment where people are told that if they speak up about conditions, they can be fired. If they post on Facebook, they can be fired. If they, so you know, you have a real reluctance of people to talk frankly about it. It's something we experience when we organize media conferences with members and even local leaders, is many of them are very worried about what the ramifications would be if their employer thought that they were saying something that could be seen as being critical. So, you know, in terms of an industry that prides itself on best practice and where you'd expect some sort of a dialectic, and you know, where things would be evidence-based and where there'd be an openness to people putting science and data on the table. No, on the contrary, in fact, that is not welcome at all. And that's one of the reasons also why we have this scandalously high rate of infection. And when, so I just think that that's something we shouldn't let pass by without commenting, is the coercive nature. And if you looked at disciplines in long-term care, the number of people who are walked out of the building in all of those facilities every week for infractions and blamed for stuff which is really actually related to the chronic understaffing, is a disgrace, actually.
Thank you, Michael and Pam. And it certainly speaks to the courage of workers like Pam, who are prepared to defy administration efforts to keep people gagged. And that's all very important. In terms of keeping up to date and adding your voice to this campaign, I want to repeat that we encourage people to visit our website, which is greenjobsoshawa.ca. Among other things, you'll see the letter that we sent to General Motors of Canada President Scott Bell a couple of days ago, demanding action on the N95 masks. And that's at greenjobsoshawa.ca/Scott Bell, if people want to see that. We have our petition there that we've been circulating for a while. I think a number of people saw or participated in the cavalcade we had in Oshawa recently, demanding the N95 masks. We have a Facebook page, so look for Green Jobs Oshawa on Facebook. And those are all ways that we are continuing this campaign. We have a question about what more we could do. Can we have weekly letters or petitions that we can all send to media or our federal or provincial representatives? How can we get more coverage? I think that we're trying to do those things, but we all need to find ways to do more. Did Jennifer indicate you wanted to? Oh no, I'm sorry. I misunderstood your hand gesture there. I don't know if there was other questions or other comments any of our speakers want to make. Rebecca?
Yeah, I have one more comment that I want to make. We should all be deeply outraged at what is occurring right now, and we should be taking this deeply personally. This isn't something that's just happening to others. These are people in our community. These are our neighbors. These are the people who are looking after our loved ones. And if we become sick, they're going to be the people who are looking after us. You know, we need to stand up for them so that they can stand up for us. And that's how solidarity works. You know, we need to do everything that we can to help them have the safest possible work environment. And that's going to make everyone in our community safer and better off. And we need to be taking this personally and acting on it as if it was happening to ourselves, not just other people.
Thank you, Rebecca. Workers a century ago said that an injury to one is an injury to all. That's certainly how we have to see this. And we have to continue this campaign. We do have to wrap up now, so I want to thank our speakers, Rebecca Keetch, Pam Parks, Michael Hurley. I want to thank James Hutt from the LEAP for facilitating and hosting this webinar. I want to thank everybody that joined us, and please be involved and please continue this struggle. And I certainly want to acknowledge and thank the Oshawa MPP from the NDP, Jennifer French, for her work and her support in this campaign going forward. So please sign up if you have not yet. Follow our updates, follow our email updates, and on Facebook and on our webpage, and we will continue this struggle. Thank you all.
Thank you, everyone. Take care.
Bye.